The muscles of the head and neck are grouped into several functional groups that have many different members. The most superficial are the muscles of facial expression. These are innervated by the 7th cranial nerve, or the facial nerve, and there are several of them. We're just going to draw attention to some of the standouts that help us make major expressions. Our frontalis muscle here lets us wrinkle our forehead. Corrugator supercilii muscle lets us wrinkle our brow when we look confused. The circular muscle going around our eye has a part that surrounds it as well as a part on the eyebrow and eyelid, and this is the orbicularis oculi muscle. Moving down to the mouth, we have an orbicularis oris muscle, so surrounding the mouth there, and pulling the upper lip, we have a levator labii superioris muscle, lifter of the upper lip. There's a depressor labii inferioris muscle, depressor or lower of the lower lip. And then we have a depressor anguli oris, pulls the corner of the mouth down when we frown. Levator anguli oris is deep here, but it would kind of pull the corner up. But there are several muscles that assist with that. The zygomaticus major here and the zygomaticus minor here are going to help pull the corner of the mouth up when we smile. Now, in addition to those, there are muscles that allow us to move our jaw and chew. These are called muscles of mastication. They're innervated by the 5th cranial nerve, specifically its 3rd branch, the mandibular branch. Our temporalis muscle and our masseter muscle are 2 large and prominent muscles of mastication. They're a little tougher to see because they're internal, but there are also ones known as the pterygoid muscles. 2 pterygoid muscles on the medial side of the jaw help move those structures as well. Also connected to the jaw, we have these muscles known as the suprahyoid muscles. Now, there's a variety of members of this group, but we're just going to worry about them as the suprahyoid muscles, and they're going to elevate the hyoid bone when we swallow. And if there are suprahyoid muscles, it stands to reason that there will also be infrahyoid muscles, and these are located here. Now, these infrahyoid, or sometimes called strap muscles, are going to help depress the hyoid, and they're traveling anterior to the trachea and the larynx. Now, one last large and important muscle of the neck has been cut in this model, so we don't really see it, but traveling from the mastoid process down to the clavicle and upper part of the sternum is our sternocleidomastoid muscle, which is going to be a major muscle for flexing the head as well as rotating it. Before we move on, I wanted to give you a quick view of the rest of the sternocleidomastoid here from the posterior side of the skull, mastoid process here, going obliquely down to reach the clavicle and the manubrium of the sternum. Note that we still have our trapezius muscle here. In fact, trapezius and sternocleidomastoid share innervation from the same nerve, the 11th cranial nerve. And just on the back here, we have our occipitalis muscle, which is actually connected all the way around the front to our frontalis muscle here. So those two are connected, and when we wrinkle our forehead, ostensibly we're also wrinkling a bit of the posterior side of the head. We just don't notice it. We've discussed the muscles of the limbs, and now the head and neck. We're going to pan a little bit inferiorly now and look at muscles of the torso. So notice that we have the clavicle here, giving rise to our deltoid, which we've discussed in the upper limb as a major abductor of the limb. But nearby we have the pectoralis major, coming from the sternum and ribs, and it is going to be a very strong adductor of the humerus, as well as a flexor of the humerus at the shoulder, meaning it brings the arm forward, as in when we're doing a bench press. In addition to the pectoralis major, there's a pectoralis minor muscle located deep to it that's going to attach to the scapula. Moving down, we have the abdominal oblique muscles, and here on this side we have the external abdominal oblique, notable for having fibers running this direction, inferior as they travel more anteriorly, and they're going to run into and contribute to what's known as the rectus sheath. So the tendon of the external abdominal oblique actually becomes the outer layer of this rectus sheath. Now, if we were to remove that, we could actually see the rectus abdominis muscles, more commonly known as abs. But those muscles are going to be located here inside the rectus sheath, helping us strongly flex the torso because they're attaching to the ribs superiorly and the pubic bone inferiorly, bringing them together. On this side, we've also reflected the external abdominal oblique, so we can now see the intercostal muscles that are present between the ribs, helping us during inspiration and expiration. And deep to the external abdominal oblique, more inferiorly, we have the internal abdominal oblique, also contributing to the rectus sheath, covering the muscles here. There's a third muscle, the transversus abdominis, that would be located deep to that, and we'll see if we can take a look at it really quickly here on the posterior side. So here on the posterior side of the anterior abdominal wall, we can once again see that rectus sheath covering most of the rectus abdominis muscles, but now we can see the very transverse fibers of the transversus abdominis muscle just here, and in addition, coming from the inferior sternum to the ribs on the inside of the thoracic cavity, we have transversus thoracis muscles. So transversus thoracis, transversus abdominis, and, little surprisingly, we have another muscle here that's going to dome upward, and it'll be a little bit easier to see here as the thoracic diaphragm. So the thoracic diaphragm is a muscle that goes all the way around the circumference of the torso, separating the thorax from the abdomen. And because its fibers are going circularly, when it contracts, it's actually going to flatten, compressing the abdominal organs, but expanding the thoracic space. And so that's the key thing about the diaphragm, is that it's going to allow breathing to happen as it works. Moving into the abdomen, we have several muscles of the posterior abdominal wall. In addition to the diaphragm's fibers that continue down inferiorly, we have the quadratus lumborum muscle going from the 12th rib to the iliac crest. And then we have major flexors of the hip. And these are going to be flexing the thigh at the hip, the iliacus muscle on the internal side of the iliac, and the very large psoas major muscle traveling all the way from the thoracic vertebra, lower thoracic vertebra, all the way down the lumbar region and out into the anterior thigh. So psoas major and iliacus sometimes fuse and are referred to jointly as the iliopsoas muscle. To finish our tour of the muscles of the torso, we're going to go to the pelvis. And the muscles of the pelvis actually make its floor. So we have a muscular floor to support the pelvic organs and all the pressure that's encountered in the abdominal pelvic cavity. On the side of the pelvis here, we have what's called the obturator internus muscle. And then coming down and doming inferiorly, we have our levator ani muscle. Now this muscle actually wraps around almost all of the organs that are trying to exit the pelvis, but because the anus is among those, and because this muscle contracts and pulls itself upward, it's known as the levator ani. It has three subdivisions, but we're not going to worry about those. Levator ani is here, and is continuous with this muscle here, from the ischial spine to the inferior sacrum and coccyx. That's going to be the coccygeus muscle, and my favorite fun fact about this is it's the muscle that allows dogs to wag their tail. So, enjoy. The coccygeus and levator ani together are known as the pelvic diaphragm because they resist the pressure from above. Now, if we flip to the opposite side, we can see the levator ani from the inferior view, and we can really see how it is somewhat dome or funnel shaped. And here, exterior to it, we have the external anal sphincter wrapping around the anus, and both it and the levator ani are skeletal muscle. So these are intimately involved in rectal continence. From the inferior view, this is often known as the anal triangle. If you squint, you can kind of make a triangle out of it. But more clearly is the anterior urogenital triangle. And in this case, we have a female model, so we can see that the opening of the vagina is here. Urethra is here. We have the labia minora here. And we have muscles crossing here. These all have names. Some of them are going to compress the erectile tissues. Others are going to wrap around the external urethral opening. So the urethral sphincter is located here. We're not going to name all of these other than I want you to know these are all muscles of the urogenital triangle. And amongst them are fibers called the deep transverse perineal muscle that wrap around, in both men and women, the urethra, and for that reason the circular area that's part of the deep transverse perineal muscle is known as the sphincter urethrae muscle. Last, we have, not demonstrated on this specimen, an area where the urogenital and anal triangles meet, and there's often a very tough connective tissue knot there known as the perineal body, and that connective tissue serves as an anchor for many of the muscles in this area, including the urogenital triangle and the anal triangle.